Let's start off by saying hello and welcome to this evening's webinar, which is all about bloating, and it's the top-down approach where you're going to learn how you can finally beat the bloat, unchain yourself from the bathroom, and finally be able to eat everything again. So before we start, I'd like to say firstly, thank you for those who have showed up tonight, or if you are listening to the recording in your own time. I do recognize that life does get busy, and sometimes finding time for yourself amongst all of the chaos can be quite challenging, but you've turned up, you've carved out some precious time. So either get comfortable on the couch, pop your headphones in, whatever it is, if you're preparing dinner, if you're going for a walk, and let's learn about the three things that everybody with bloating wants answers to and why healing requires a top-down approach. So just to make sure that you're in the right place and you know exactly why you've registered, let's go over exactly who this webinar is for. So you're somebody who wants to wake up with a flat tummy every single morning and keep it that way throughout the day. Now you want to be somebody who can eat out again and eat all of your favorite foods at your favorite restaurants and cafes without having to leave early to either rush to the bathroom or put on some loose, comfy clothes again. You want to be able to eat all of your favorite foods again, from that indulgent creamy pasta to a deliciously ripe apple to a fragrant garlic infused stir fry. And you also maybe are somebody who wants to feel energized, alert, and abundant from the foods that you eat rather than feeling bogged down, sleepy, and in a world of pain. Have you ever experienced that dreaded bloat where you feel like you have a balloon blowing up in your stomach, feeling like it's ready to pop, or you feel like you're 6 months pregnant? Well, if you answered yes, or if any of these things resonate with you, then this webinar is definitely for you. So just in case if you're wondering, who is this webinar not for? So it's not for somebody who has never experienced any bloating or gut issues before. I mean, if that's you, tell me what your secret is, firstly. Maybe you're somebody who is okay with feeling bloated. You're okay with feeling uncomfortable and you enjoy the surprise of irregular stools. Maybe you're somebody who's not ready to reintroduce all of the yummy, delicious, wonderful foods back into your life. Maybe you really don't care or have an interest for the gut microbiome and how you can learn about how its close influence has direct correlation to your overall health. And lastly, this webinar is not for you if you're not ready to be the best version of yourself. If you don't feel that this is for you, look, I do suggest and invite you to stay along because I'm sure that there is somebody that you know that will benefit from this. So in today's webinar, I'm going to be covering three things that everybody with bloating wants answers to, and the strategies that I use within my clinical practice with the clients just like you who struggle with bloating, IBS, and a growing list of food sensitivities. We're going to touch on why so many people are bloated and what your GP may be missing in your treatment. What are some of the common myths and mistakes when it comes to bloating, and why healing should be a top-down approach, which I'll go into more info later on. And I'm lastly going to go exactly into what you need to do to finally banish that bloat. And I can assure you that it's not those detox and debloat supplements. So stick around. I'm going to walk you through exactly what it is that I do with my clients to help them get to the root cause of why they are bloated, how they get the appropriate testing to know actually what's going on, so testing rather than guessing, and how their food and lifestyle choices can either be a direct roadblock or a path to being free from bloating once and for all. Also, make sure that you do stick around towards the very end of tonight's webinar because I have a really big announcement of something that I've been working on for quite some time, something very special, and hopefully you watching will be one of the first people to experience it. And also, just because I want to say a huge thank you for registering and even just showing up tonight, is that everybody will be getting a freebie heading your way. So keep an eye out in your emails tomorrow, and this will start to support your health healing journey. So I've worked with hundreds of clients who sit in front of me expressing the concerns of their bloating and their IBS. So take a moment, and do any of these things sound like you? Do you suffer from chronic bloating and gas after most meals, if not all meals? Do you feel that you have a growing list of food intolerances or sensitivities and you feel like you've been left with fewer choices these days? Do you feel that you experience difficulty or pain after digesting food? Do you feel that you've got inconsistent stools, loose one day, hard the next, nothing at all the next? Are you feeling fatigued, have low energy and brain fog most days? And do you feel that you've got growing anxiety around stress and food? And are you finding that it's becoming more and more difficult to maintain a healthy weight, or you're noticing a decline in your relationship to your body? Other things we want to consider is, have you noticed that you have a growing fear of eating out, eating with your friends, socializing? Do you find that it's difficult finding clothes that fit you comfortably and that maybe you're having to size up or choose those looser fitting clothes? Are you beginning to feel anxious and socially isolated, like you're the only one who's experiencing this? Do you find that your day-to-day activities are affected at work and at home and everywhere else? Do you feel that there's a lack of understanding and compassion from your family and friends? As much as they care, sometimes they don't know how to support you appropriately. And finally, and probably most importantly, is, do you feel that you've been completely dismissed by your GP and your specialist? So hopefully you're not saying yes to too many of these things, but these are the things that I hear so consistently with clients and patients who sit in front of me. So let me tell you a little bit about my own personal journey, because, hey, we all have a bit of a journey to where we are today. So I have suffered with IBS on and off for a number of years, and I didn't really actually know what was triggering my symptoms, and I certainly didn't know what to do back then. So it wasn't uncommon for me to wake up with a really flat tummy, which I was proud of, but all it took was for me to eat something super delicious, and shortly after I donned a incredibly painful, distended, rock hard belly that just wouldn't settle. I would end up being left feeling hungry and starved, because no matter what food that I ate, it just kept on re-triggering me. There was absolutely no pattern to my symptoms. It was just a merry-go-round of pain and discomfort. I also had to recognize, though, at that time, the stress in my life was a massive trigger for my gut symptoms that needed resolving. So I know what it's like to get lost in the healthcare system as well, to fall between the cracks and, feeling like I'm not sick enough, but I'm not in pain, and I wasn't taken seriously enough. And I was told by a GP, believe it or not, that I just have to live with it. So after taking the time to really stop and truly listen to my body, I was able to engage in some support of my very own team of practitioners, from naturopaths. I worked with nutritionists and Chinese medicine practitioners and even a psychologist. And I was able to address my bloating and gut issues through a very complex but top-down approach and really get to that root cause. So why I'm telling you this is because know that there is always almost a reason for why you are symptomatic, and know that your body's innate intelligence is to communicate to you when it does need a little bit of extra TLC. So whilst my gut health journey is going to be exactly that, it's a journey. And I know for some of you who follow my Instagram, I do share my experience. I'm human. I may be a practitioner, but I'm human. But know that through the right support and educating and empowering yourself, you too can be bloat free, just like me. So have you actually ever heard this? So bloating and other digestive symptoms are just something that you have to live with. I know so many of my clients have fallen to compliance or complacency, and they've gone, you know what, this is me. I've felt it for 5, 10 years or even longer. Well, this is a massive lie. And I'm here to tell you that you don't have to live with these symptoms for any longer. I'm here to tell you that there is a likely reason for your bloating. It just takes time to work with somebody who has the right skill set and the time to investigate it thoroughly with you. No, you don't have to go through invasive or expensive procedures and leave. So we want to leave the surgeries and the scopes as your absolute last resort. Yes, you can definitely begin to eat all of your favorite foods again. No, if you follow a plan, it won't keep happening if you focus on getting to the root cause and take a top-down approach. And yes, I do promise that you can start to feel confident in your body again. So, a bit of a hello again. So I want to introduce myself to you. So my name is Monica Anna, and I am a fully insured, I'm a registered clinical nutritionist, and I'm a very passionate practitioner with a focus on digestive health. Now, I love to use my philosophy as food is medicine and that nature knows best. I engage in functional pathology and blood testing to apply scientifically supported strategies and treatments. And we apply holistic lifestyle approaches that your entire body is going to benefit from. I've worked with hundreds of clients just like you to be able to resolve their symptoms, get to the root cause of their health, and support them ongoing through all things gut, hormone, metabolism, and even fertility. So it's only human nature to seek support and guidance from our trusted GPs when things aren't operating the way they should. But have you ever been told by your GP that it's in your head and possibly you leave feeling disheartened, dismissed, and they kind of give you a script for antibiotics and no pathway forward? So if that's the case, what is your GP missing? Why are there still so many people out there that are experiencing bloating and IBS? So statistically, we know that at least 50% of Australian adults will experience unpleasant gut symptoms such as bloating, gas, constipation, and 1 in 7 will experience distressing symptoms. So it's not like this is a condition that's going under the radar. So many clients tell me that when they spoke with their GP, if they had a lucky GP, that they were told to try the low FODMAP diet, but they didn't really understand why, for how long, and what to expect. So the low FODMAP diet, it's a diet that's been developed by Monash University researchers here right in Melbourne, which is really exciting. And it is a proven strategy designed to improve digestive discomfort for IBS sufferers. But it has been designed to be followed under strict supervision of a qualified practitioner who specializes in the area. Not many people realize that it's designed to be followed for a maximum of 6 to 8 weeks with gradual transitions of food reintroduction. Unfortunately, so many people make the mistake of cutting out the FODMAPs as instructed by their GP, only to reintroduce them with little to no symptom changes, leaving them with the elusive diagnosis of IBS from their GP. Many clients also end up hopping from doctor to specialist and ending up forking out thousands of dollars and just getting stuck in really long wait lists. The average out-of-pocket expense for consultations alone can range anywhere from $3,000 to $1,100 for private specialists. And unfortunately, in more recent times, despite the suggested 30-day recommended waitlist time, Aussies are waiting up to 12 months for public care for non-urgent conditions, which bloating kind of falls under that category. And for those people as well who end up going under the invasive colonoscopies and gastroscopies, it's not uncommon for their reports to come back stating unremarkable, meaning we haven't been able to find anything, so there mustn't be anything wrong with you. I've seen so many of these reports that it's really disheartening as the patient to get that, because they do have symptoms. It is critical that they get on top of their symptoms. So this is where holistic nutrition support really shines. So myself as a nutritionist looks at your gut health from a root cause perspective. Maybe you've heard this before. So it's a perspective that takes a different approach to the conventional medical model. It treats the whole person rather than just focusing on just the symptoms. We aim on finding out what is exactly triggering your bloating, and we dig into the why. The more I listened to my clients, the more I understood that bloating is really complex and it can be layered. We want to explore the why behind your symptoms. And this may look like considering how your lifestyle, your sleep patterns, stress levels, of course, your nutrition and movement routines will affect your bloating. So I have created a formula that's going to support all of these people, just like you, who are suffering and feeling frustrated and ready to get back to the finer things in life, like is what you can see on the screen, cheese and crusty bread. So I want to share with you a bit of a client case study. So one of my clients, so female, she came to see me, she's 35 years old. She had an IBS diagnosis from her GP, but they hadn't done any official testing. Her symptoms included, so she was frequently constipated. She was only going to the bathroom 4 times a week, and they were type 2, meaning they were really hard and they were quite difficult to pass. She was bloating after most meals within 10 to 20 minutes, describing the bloating like a balloon expanding in her stomach with painful pressure, often associated with left side cramps and stabbing pain. She also noticed smelly gas pretty much all the time, and it smelled like rotten eggs. It's really important to note that she had traveled to India 6 years ago, and she noticed that her gut wasn't really all that right since then. She had spoken with her doctor, and she'd had about 5 courses of antibiotics in that period. Her doctor did suggest that she try a low FODMAP diet. She'd been doing it on and off for about 9 months, but she was still symptomatic. So at this point, when she's sitting in front of me, she'd completely cut out dairy, gluten, onion, garlic, honey, apples and pears. So quite a few things there. She was also starting to skip breakfast because her pain and discomfort was just too much. And so that meant she was only getting 2 meals in a day. So we ran some tests. We did some tests. It's so important to test and not guess. So having a look at the screen, we could actually see, so she had an unformed stool. So it wasn't solid. It wasn't exactly what we wanted. We found that she had low secretory IgA, meaning poor immune function, which unfortunately increases food sensitivities and also the likeliness for pathogens, meaning bugs. She had something called high zonulin. So this is a direct marker for leaky gut or gut permeability. So this was something that we had to jump on straight away. We also noticed in the bottom here with her normal bacterial gut flora that she had a bacterial overgrowth. We had some species that she just simply should have not had in those amounts. And she also had some low beneficial bacteria. So this in itself was more information that she was able to get from one test than what she did working with a GP for over 6 years. So what did we do? So I saw her, and whilst we were waiting for her test results, we started on with some warm, easy to digest meals. If you've been following me on my socials, you know that I harp on about this all the time. We did start her on a low FODMAP diet whilst we tracked her symptoms. It was important to start tracking. I encouraged her to start eating breakfast. We supported digestion with some supplements, and we looked at breath and meditation techniques. We also focused on increasing some dietary protein and collagen intake to support the gut lining and the healing, and also her energy levels. We also incorporated some kiwi and dragon fruit daily to help with constipation. Once we got the results, we added in some targeted gut healing nutrients to start working on that leaky gut. We also added in some immune regulating nutrients and foods to address the low secretory IgA. We worked with practitioner only probiotics that had specific strains to support that beneficial bacteria, and in addition to some wonderful prebiotic foods. Now, after 8 weeks of working together, most of her symptoms had reduced quite dramatically. She was still adhering to a low FODMAP diet. She still had her supplements, and she was still doing her regular breath work. She noticed that her stools had improved, and she was having a stool movement most days. Maybe she skipped a stool once every now and then, and they had improved from a type 2 to a type 3. So a little bit more easy to pass, a little bit softer. Now, she was able to start reintroducing some low lactose dairy options, some garlic infused oil, and we also treated her to some sourdough. She hadn't had much gluten for a very long time. So she was able to now eat out once to twice a week with the support of her supplements, and she could feel quite confident that she could order off the menu, and she knew what she needed to sub out. She did still notice some smelly gas after eating out occasionally, but it was significantly less, and she was able to actually identify what foods or what meals triggered that. So how's she going today? So after 6 months of working together, no bloating. We got to the root cause. She goes to the bathroom every single day with little to no discomfort. She's able to consume most foods without any symptoms, or at least she is very much aware of her tolerance levels and confidently knows what works for her. She's no longer tied to a diet or a restrictive food plan and is comfortably eating 3 meals a day, and we're encouraging her on getting more snacks to support her energy. She is still taking some supplements, and she is also still working on some daily meditations. Now, we did retest and we noticed that her zonulin, so the marker for leaky gut, it was reduced. It was still elevated, but it had reduced. We had finally eradicated that bacterial overgrowth, which was a massive win for her. And we improved that overall beneficial bacteria because of the probiotics and the prebiotic fibers. And then we had some added bonuses in there as well. Her iron levels started to increase. She has not been able to increase her iron levels in the past 6 to 10 years. She had less brain fog and she started to notice more energy. So, hearing that story, I want you to take a moment to think about this. So we've heard the saying that all disease begins in the gut. So this was spoken by Hippocrates, known as the Greek godfather of medicine. Have you also heard the saying that if nothing changes, nothing changes? Well, if we continue to ignore our symptoms of bloating, it can actually begin to lead to several long-term consequences, from pain and inflammation, brain fog, adrenal exhaustion, autoimmunity, nutrient deficiencies, thyroid dysfunction, depression and anxiety, and even difficulty conceiving. Now, I know that there's a lot there, but we need to really consider what goes in the gut is going to play a systemic response to all of our other systems in the body. So I hear so many myths when it comes to the gut, and so many mistakes that people make when it comes to their gut health and trying to resolve their bloating. So have you ever been told that bloating doesn't exist and it's all in your head? It's a lot of gaslighting happening. Have you ever heard that stress levels have little to no impact on your gut? Did you know that supplementing with the wrong supplements can actually make things worse? This is why I don't recommend anything from Chemist Warehouse or over the counter. Have you been told that you need to cut out dairy, cut out gluten, cut out coffee for life? Seems really mundane. And this is my favorite one. If you're bloated and you can't poop, just take some laxatives and just get on with it. So these are huge mistakes and these are huge myths that we really want to nip in the bud. This is where this whole top-down approach comes in. Your treatment should consider what's going on up here to resolve what's going on down below. I'm always telling my clients that in order to resolve what's going down within the bowels, we need to think about the top. It's not all in your head, but what it can be is educating and empowering yourself to know that you can truly listen to your body and know how to confidently advocate for your own health. It's about learning mind-body techniques and realizing that stress, it does have an impact on your bloating. We know that when cortisol is released in response to stress, that it can suppress digestive functions such as salivation, stomach acid production, and even the intestinal contractions, which I've talked about on my socials. This can lead to digestive issues such as bloating, constipation, even diarrhea. So we know that chronic stress and elevated cortisol levels have also been linked to irritable bowel diseases, IBS, and other disorders such as SIBO, or small intestinal bacterial overgrowth. I've already touched on the importance of identifying your triggers and using a specialized root cause approach to healing, and working with a trained and qualified professional to implement appropriate gut healing foods and supplements that mean you're going to allow your body to actually heal and enhance its function and restore its optimal health. And lastly, when it comes to resolving your bloating, meeting your microbiome is quite possibly one of the most fascinating parts of the journey. Those who know me, I talk about poo all the time because there's so much that's going on in there. So I am so far covering a lot, and hopefully I haven't left you feeling too confused and too overwhelmed, but please stick with me because I do have something for you. So there is something that I have been working on really quite hard with a number of my clients to finally be able to bring you all something that's super special and finally a solution for your bloating frustrations. I would love to present to you my Deep Within the Gut formula. So I've created this program with the idea of deep within all of us, we have this wonderful innate wisdom for healing. And our bodies are designed to heal, given the right environment, the support, and the tools. So deep within, we can access our true potential when it comes to healing and gut health. So I have created a beautiful 3-month one-on-one proven program just for you. So how does it work? What's the formula? So when I work with you, we do a holistic health assessment and we look at appropriate testing. So every single person is different. So we got to have a chat. I want to get to know you. I want to understand what's going on with your health history. What's your current diet? What are your symptoms? We're going to look at some blood testing and we're going to look at some microbiome mapping. We look at giving you a clear nutritional guide. So clear guidelines of what to include, what to reduce, how long for, and most importantly, why. I talked about it on my socials the other day about educating, and when you have more skin in the game and when you understand it, you'll be able to implement it so much more. And of course, I've got really yummy recipes and meals that I provide you. So we look at supplementation. We look at customized practitioner-only products that are going to give you some symptomatic relief against your bloating, but we look at deeper gut repair. Education. You're going to get guides. You're going to get beautiful resources accessible all online that are going to expand your knowledge and empower you to know how to read and listen to your own body so you can advocate for yourself in the future. And of course, lastly, we've got support and accountability. I'm here with you the whole way. Know that you're not going to be left behind. You're not going to fall between the cracks. You're going to be heard and you're going to get all of your nitty-gritty questions answered. So what have we learned so far? So I've talked about why so many people bloated and what your GP may be missing. We've talked about some of the bloating myths and mistakes and why healing, in my opinion, should be a top-down approach, and a little bit about what exactly it is that I do with some of my clients to banish your bloat. So there's quite a few reasons of why I know you're going to love the Deep Within Gut formula. So you're going to be truly heard for the first time. This is a program that is exactly for you and exactly what you need. You're going to finally get the right testing as well in this. You're going to get recipes that I promise are actually simple. They're easy to make and you're actually going to enjoy them. I know that I've got a couple of my clients listening on tonight and hopefully they're sitting there nodding their heads knowing that the recipes that I give are easy and really tasty. Through this, you're going to know that you're going to feel more confident in your food choices. You're going to know exactly what to enjoy and what to temporarily skip out on. You certainly don't need to waste your money on crappy supplements anymore, that knowing that you're going to be prescribed high quality practitioner-only products that are therapeutically effective. Everything that you learn will be practical and it will be easy to apply, and you're going to become your very own gut health expert. Sure, I'm sure that you probably heard or at least maybe tried meditating, but you're going to have a completely new tool belt in your de-bloat belt and you're going to become a master of mindfulness when it comes to eating and being present with yourself and your food. And you're going to actually understand why this is important and how it helps. And like I said earlier, know that you are supported every single step of the way. Accountability is consistency. Accountability and consistency is key. So know that I've got you throughout this whole process. So maybe this formula is not for you and it's not going to be for everyone, and I'm okay with that. And I do invite you to try and do it on your own. But you can go do a Google search, and I did this myself, how to get rid of bloating. And there are 91 million results for this. Yeah, I'm not sifting through all of that information. You can try those fancy detox and defloat supplements, but they're not therapeutically effective. And do you know what you're actually having? Do you know what to look out for? They're being branded really well. I will give them that credit. You can certainly just continue cutting out all of the foods that you are eating or not eating at the moment. And if you're okay with it, you can kind of just deal with it and just say, it's IBS. But I do want to support you through this whole process and this journey, because I know that there is a heap of misinformation out there and it gets really confusing really quick. And I mean, if you are going to try it alone, it's likely that you're not going to have access to the appropriate testing. And even if you do get your hands on it, Do you know how to interpret them appropriately and what the next steps are? I also realize that life gets busy. People get distracted, things happen, and old habits do creep in. These things take time. They take time and some diligence, and a lot of people just give up way too quickly. Motivation, it lasts a couple days. Discipline is tough. And like I mentioned before, store-bought supplements can certainly make things probably a little bit worse. So if you're going down that pathway, make sure that you proceed with caution. So if you are recognizing that you do have these symptoms of bloating and gut discomfort, ask yourself, how long have you been feeling this way? 3 months, 6 months, a year, or even longer? Well, what happens if you just let this go on? Well, you're opening yourself up to potential nutrient malabsorption and deficiencies, intestinal damage, increased risks of infection, weight gain, decreased quality of life, a potential decline in your mental health, brain fog, fatigue, difficulty conceiving or early pregnancy loss, pain, hormonal imbalances, weakened immune health and autoimmunity, increased inflammation. Now, I know it sounds all grim, but we need to keep coming back to the idea that all disease does start in the gut, and we all eat every single day. And so the foods that we consume absolutely has a direct correlation to our future outcomes with our health. So here it is once more, but a little bit more depth. So the Deep Within gut formula, it's a proven 3-month method that's been designed to help people just like you to finally get rid of their bloating and enjoy the food. So what's exactly included? So we've got your initial consultation. We spend an hour together. We've got 4 30-minute follow-up consultations as well. We're looking at comprehensive blood and microbiome testing and including that interpretation. Now, it's important to note that we are assessing them against optimal ranges, not just the reference ranges that your standard GP looks at. You get all of your supplements for 3 months. You get to directly chat with me between consultations. This isn't really something that I allow at the moment with my one-on-one consults. I allow it here and there, but this is going to be exclusive. You're going to get more talk, more time with me. You're, of course, going to get all of your recipes, your meal plans, your inspiration, your guides. I'm going to be throwing in a fortnightly group coaching call. Know that you're not alone on this, and people have questions, and I guarantee if you have a question that there's other people there, and it's wonderful to know that you do have a community to support you through this process. We're also going to have a private Facebook community, and there's also going to be some really great bonuses. I've got an osteopath and I've got a psychologist working with me. We're going to bring you some really, really interesting topics to talk about and how other components and other systems influence the gut. So I know you're all waiting for this. So what is the investment? So for the full 3 months of a proven formula that is well and truly over $4,000 worth of value, the investment is shown on the screen for you right now. But because you guys have joined me tonight, I do have a webinar special just for you guys. Now, I am only going to be taking on 10 participants, and it's going to be an intake in June. So we've got a little bit of time before it does start. Now, all you need to do essentially to lock in and secure one of your spots within the Deep Within community is pay a deposit, and we've got to organize a discovery call. So as I said, I will be capping this at 10 people only. I will do future intakes, but we're just doing one for now. So what are the next steps? I want you to book in a free, no obligation discovery call. Let's have a really brief chat to identify if this program is exactly for you and whether I think that this is appropriate for you as well. So I will be taking a small group of people. That's exactly what I've said there. And it's going to obviously be, I'm going to have some payment plans, excuse me. So don't stress if you're looking at that number going, oh my gosh. So I'm going to send out an email tomorrow morning with the booking link. And I do recognize that I say on the screen that I was going to drop a link into the chat box. but I don't have that close to me. So you have attended tonight, and I will be sending you the booking link. I don't have that many times open for this week, but please take a moment, find yourself some time. I've got some more information coming through with those emails, and I'll have some time on my website, some information there that you can have a look at. So thank you so much, everyone, for attending. I do really, really appreciate the time that you've been able to sit down and sit with me and listen to the information that I had to share. So remember that for those who have showed up tonight, you do have a freebie coming your way with a wonderful PDF. If you have any questions or queries, please reach out. But that's it for this evening. Thank you so much.